from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Every 40 seconds, someone in the United States has a stroke, and the CDC reports that every 3 minutes, someone dies of a stroke. Doug Lewis suffered a big one, but he's here today thanks to doctors here at the University of Kansas Health System, along with another hero in this story who's much smaller and much younger than anyone you typically find in scrubs.
Very, very breakable.
Doug Lewis cherishes every moment with his 3-year-old daughter, Sarin, and now they have an even deeper bond. He says Sarin is the reason he's alive today.
I lost all strength and coordination in my entire left side, but I went to take a step and my left leg wouldn't move, and I face planted onto the hardwood floor right here. It
was an early morning in December of 2022. Doug was downstairs playing with his 5-month-old son. The rest of the family was upstairs still asleep, when suddenly he found himself on the floor, confused, terrified, and unable to move.
Then my daughter did wake up and came down the stairs and saw me laying there.
Sarin ran and got her mom, who immediately recognized the signs of a stroke and called 911. At just 45 years old, this was Doug's second major medical emergency. The first was a heart attack when he was only 38.
All of a sudden, it was like a Mack truck just slammed into me. It's a Widowmaker vessel, had a blockage in that one, and typically with a Widowmaker heart attack, people just keel over and die right there.
He would survive, but that heart attack at 38 would lead to this stroke at 45.
They weren't able to repair, so I have the lower tip of my heart is essentially kind of dead tissue that doesn't pump when the rest of my heart pumps.
Over the next 7 years, a clot developed and grew. It was a ticking time bomb in his chest. And that December morning, 2 pieces of the clot had broken off and traveled to Doug's brain. When Doug arrived at the first hospital, doctors told him they knew of a new procedure that could save him, performed here at the University of Kansas Health System, which is where they rushed him next.
Essentially just kind of vacuumed him out of the vessel, which was pretty cool.
On this day with his little girl, Doug is so grateful for the medical team that saved his life, a team that would not have had the chance if his little girl hadn't heard him fall and run for help. We are so pleased to welcome Doug Lewis to today's program just a little more than a year after that frightening stroke that you had. We're also joined by Dr. Michael Abraham. Dr. Abraham is a stroke and brain expert here at the University of Kansas Health System, and he's also a neuro-ICU doctor and the director of stroke research over on the academic side at the University of Cancer Medical Center. So you're the guy that patients want to see, and the family members want to see if they're coming in with an emergency like Doug had. Doug, how are you feeling today?
Feeling great.
Parents often talk about how having a child changes your life, but in this case, having a child saved your life. Does your little girl have any inkling that how she helped Daddy in an emergency?
Well, you know, she knows that she was Daddy's hero. You know, I tell her that frequently, but I don't think that she understands the gravity of the situation that occurred. You know, but
how old is she now?
She's turning 5 this summer.
So cute. She's so sweet. This was your second major medical event. The first one was before you turned 40. That was your first heart attack. How old were you when you had your heart attack?
38 years old.
38. And were you being seen by a cardiologist after the heart attack?
Yes. I was doing annual visits.
Did you have any idea that you had a clot from that heart attack?
So early on, immediately following the heart attack, there was a small clot. I was on blood thinners for probably 6 months to 9 months, and then they had determined that it had dissipated at that point, and so I went off the blood thinners, and at that point I guess is when it started reaccumulating over time.
And were there scans that could have detected that, Dr. Abraham?
There could be, but if we've seen that a clot has dissolved, as in your case, there's not necessarily an indication to continue to do routine imaging for that.
Is that your medical beeper going off? Do you need to? No,
Yeah,
you can
I'm
check
good, I'm
that.
good.
Patients come first.
Yeah, I'm good right
You're
now.
all right?
Thank you,
Okay. So this began in Doug's heart. It traveled to his brain. That's where you come in. What is the name of the type of stroke that Doug had?
He had what we call an ischemic stroke. So that means a blockage in an artery going to the brain. And when that happens, it cuts off oxygen and nutrients going to that specific area of the brain.
And to fix this, you perform something called an endovascular thrombectomy. Doug says it, which was more understandable to me, is that you vacuumed the clot out of his brain.
Essentially, yeah.
That's what happens. We have an animation that shows what happens during an endovascular thrombectomy. What do you put in there to suck the clot out, and how big was the clot in Doug's brain?
Yeah, so this is actually a device that we use called an aspiration catheter.
And we'll show that in 1 second after we watch this animation. So the catheter goes in.
Correct. Goes up to the brain, and we get it to the face of the clot, essentially cork it in there, and outside of his body, it's connected to an aspiration pump, and my tech will turn it on, and it provides continuous sucking or aspiration as we're pulling it out.
That is wild. Now I'd love the show and tell. You brought an example.
So this is an aspiration catheter, something we typically use to take into people's brains to suck out clots. And it looks very small, but in reality it's a very big opening here relative to the size of the arteries in the brain.
Can I?
Yeah, please.
What's it made out of?
It's made out of several polymers, and there's even a metal braid in there because it has to have some kind of structural integrity in there, because we're taking it in, it has to be soft enough, but also we want to make sure that when we apply that vacuum, it does not collapse on itself.
This feels kind of like rubber, like a rubbery material. How do you get this into Doug's brain?
Yeah, so we start at the top of the leg. That's a typical area. It's a very large artery there, and under continuous X-ray guidance with my fingers, I'm guiding these catheters over smaller wires around the turns and into the brain. Yeah.
Doug, is it surreal to hear Dr. Abraham talk about putting something like this and weaving this through your leg into your brain?
Oh, absolutely wild, yeah.
Now, were you awake during the procedure? Because in some cases, the patients remain awake.
I don't think I was for that.
Yeah. You were fully asleep for this one, yeah.
In what cases would the patient stay awake?
We used to, earlier in the days, try to do it with patients somewhat awake, but we've found in working with our anesthesia colleagues that we have such a streamlined process where once a stroke patient gets here, we immediately evaluate them and then we can put them to sleep. And that also helps us, because sometimes if you have an awake patient, and especially if they can't speak, then they're confused and they move around. That increases the risk of complications during these procedures. So.
I think it would be so scary as a patient to be, at least, let me say that, I would be not scared, but freaked out, knowing what was happening. I know I'd be safe and in good hands, but I would be the patient thrashing around, moving around, trying to ask questions and such. You brought some images of Doug's brain.
Yes.
And these are really interesting images. We have them in the monitor behind us. What kind of image is this?
So this is a picture of the catheter angiogram. So what we call digital subtraction angiography. So this is a side view of Doug's brain, with this being the front of his brain, that's the back of the brain. At the bottom, that dark line, that is his carotid artery, and in the blue area, that's the whole area that's missing blood flow. So a very large portion on the right side of Doug's brain.
Because there's a clot somewhere in there.
Correct,
Can you see where the clot is?
Yeah, so right here where that arrow is pointing, that's where my catheter tip is, right at the clot there.
Okay.
So I get it up there, turn on the suction, we suction it for about 4 minutes, and then very slowly pull it out, because we don't want to pull it too fast, because if we pull it too fast, the clot can dislodge and go back up or break off and cause
into like one or two pieces. And then this third image.
Yeah, afterwards you see now blood flow has been restored to that area of the brain.
So that's what it's supposed to look like.
Correct.
All those roads should be
wide open.
Wide open. Yeah. Wow, that is so interesting. Is this a newer procedure? How long has this been around?
We've been doing this now for a good 15 plus years. I mean, it's been around since the early 90s, but I would say in the last 10 to 12 years we've had the most amount of advancements in these aspiration catheters and other devices to get into the brain to pull clots out.
So from your experience, Doug, you go in, do you see Dr. Abraham and he says, we're going to put you under, and when you come to, you're going to be fine. What's it like for you as a patient? What do you remember?
Well, yeah, I remember meeting Dr. Abraham before the procedure, and he just kind of gave me a layman's explanation, like he did for us just now, of what's happening, and you know, I put my trust in him and saw him the next day, I think.
Yeah.
So.
And what was the recovery like?
So I think I was extremely blessed. My recovery was pretty drastic and almost complete within a day or two.
Within a day or two?
Yeah,
and you were back to normal?
I would say 90%, 95% back to normal within a day or two. I was up and moving in my hospital room within the first day. So, yeah, I mean, I feel extremely blessed.
Wow.
To have that quick of recovery.
We talk a lot about how time is so critical when you're suffering from a stroke or a clot. Doug was first taken to the emergency department at Olathe Medical Center. Then he was transferred here. Can you talk about the transfer process with the emphasis being so strongly on time?
Yeah, time is brain. Every minute of no blood flow, we have about 2 million neurons dying. And that may not sound like a lot when we talk about the billions of neurons in the brain, but every portion of the brain is critical to our normal function. So every minute literally counts.
We have some pictures you shared with us yesterday, and these are so interesting because these are pictures of other clots that Dr. Abraham has removed from other people's brains.
Correct, yeah.
About how big would these be, like the size of a pencil eraser?
Yeah, roughly. They're about 3-4 millimeters, and these are 3 clots from one person's brain that I took out a couple weeks ago when I was on call.
How often do you do this?
That week was particularly busy. I had 7 endovascular thrombectomies in 7 days.
Wow.
That was exceptionally busy, yeah.
How long are the procedures?
You know, the faster we can get with these devices, typically they're about 45 minutes to an hour.
High stress, high stakes.
Yeah, everybody's moving very quickly, and like I said, we have anesthesia, the nursing, the techs all moving together to get patients, you know, on the table, asleep, prepped, and then get into the clot.
How big was Doug's clot compared to those the 3 little guys you just showed us?
His was a little bit smaller, and we just got 1 piece of clot as opposed to 3 pieces like we see in that picture.
You got 1 piece. It was a little bit smaller.
Correct,
it's probably nice to hear.
Yeah.
It wasn't a whopper.
Yeah.
But it's remarkable that you can remove those from someone's brain.
Yeah.
We have lots of community questions coming in from our viewers. We love when you send us questions because really they're the heartbeat of our show. You can send them to us in real time on YouTube, Facebook, the X platform, or you can send them to us on the All Things Heart email. All those links are right there on your screen. And we have some that have already been submitted. Sarah wants to know, does having a heart attack increase your risk of later having a stroke?
It potentially can, because as Doug said, you know, a portion of your heart is just not pumping. So normally the heart pumps in a very coordinated manner where the blood flows nice and smoothly. But if you have a portion or a larger portion that's not pumping properly, that blood can become stagnant. And when it becomes stagnant, it forms a clot, and typically the next place it goes to is the brain.
And Doug, your heart attack was at 38. That's so young. Did any heart issues or problems run in your family? Do you know what caused it?
Yes, there is a family history of heart issues, but the particular heart attack that I had was a SCAD, spontaneous coronary artery dissection.
Right.
Which I guess they said they couldn't really tie it to one thing in particular. It was just kind of a odd one-off.
Just bad luck.
So, yeah.
Well, that's a bad one-off to have that happen. Your daughter saw you on the ground, ran upstairs, got her mom. How did her mom recognize that you were having a stroke?
So actually, her father had a stroke 4 or 5 years prior.
Your daughter's grandpa.
To my incident,
yeah.
yes. Mm-hmm. And she had witnessed the signs through him, you know, of like the facial droop and loss of movement on one side and things like that. So
we're talking about the acronym that we have. It's called Be Fast. This is so useful. It used to be just FAST, but they added BEFAST. Dr. Abraham, can you talk us a little bit through, we know balance, if someone's losing their balance, eyes. What should people look for in the eyes?
The eyes, the big thing we're looking for is vision loss. And most of the time it's going to be one-sided vision loss, so the right side or left side.
Did you have that, Doug?
No, I maintained my eyesight. I think.
You just lost all balance. Face, facial drooping.
Correct.
Arm, weakness in an arm.
Yes.
Speech slurred, and then time.
Yes.
Time is of the essence. Do you remember what it felt like when you were having your stroke?
Felt like the most massive headache I ever had in my life. And it was just disorienting, you know, hard to collect my thoughts, and I don't think I had a problem communicating, but at times it was hard for others to understand, so I guess maybe there was some slurred speech or something along those lines.
We often hear that from family members. Family members will say that the person having the stroke sounded like they were talking gibberish, and the person having the stroke felt like they were saying real words.
Yeah.
We have some really good community questions. Jean Reardon, one of our Facebook viewers, wants to know, is there any way the catheter could create or dislodge a clot as you insert it?
Correct, yeah. So when we go up there, you know, there's always a risk of causing, you know, of any complications. So when we pull it out, we have to pull it out very slowly so that we try to get that whole clot in there, because if we don't, there's a risk that we may pull it out and then it gets dislodged and stays in there or breaks into smaller pieces.
Can a catheter create a clot?
Potentially, yes. Typically in the stroke situation, not so, but there's other procedures we do when we treat aneurysms or do other stenting procedures. Sometimes clots can form just because, you know, these arteries look big here, but in reality they're only maximum 5 millimeters in diameter.
Tiny.
So you're adding all these foreign devices in there that also can slow down the blood flow as well, cause clots.
Stu wants to know if Doug's recovery timeline is typical. You had what sounds like a fast recovery. Is that normal?
No, unfortunately not. You know, sometimes we'll get really good pictures like Doug, and then people can still have strokes. So that goes back to what we were talking about, time is brain. So the fact that your daughter recognized something was going on, called your wife, called 911, and, you know, everybody mobilized quickly is critical.
Did you have to make any changes in your lifestyle? Were you always fit and active, and this is just a bad luck side effect of that one-off heart attack?
So up until my heart attack, I was in fairly good shape. You know, that's really been kind of the more limiting factor to my overall health since. I have to work pretty hard to stay in better shape and not put on too much weight, et cetera, you know. My metabolism is just not the same as it used to be.
None of ours are, right? Have you made any dietary changes? Was that necessary at all, or are you still cruising ahead with what you were doing because it was healthy?
Yeah, I try and maintain as well as I can with a healthier lifestyle at this point. Having been given a gift of extra time twice now, you know, I try and stay mindful of that and keep on a good path with it.
Do you buy lottery tickets now? Because you should. You really should.
Maybe I should.
I think you should. Piper wants to know, is there a most common age to have a stroke?
Typically it's older people, so 60 and above, but more and more we are seeing, unfortunately, younger people have strokes due to various other things.
What other things?
One thing, you know, as you talked about with your coronary artery, there's a dissection. Sometimes we can see dissections in the carotid arteries going up to the brain as well. And when you have that dissection, it can narrow the artery, slow down the blood flow, also causes stroke as well.
For people unfamiliar with a dissection, what is that? What's happening?
If you're looking at an artery like this, these are the two walls of it. A dissection is where a portion of it tears away like this, the inner layer of the artery. So when you do that, you're slowing down the blood flow. And when you slow it down, again, it can create clots and go up to the brain. Yeah. So sometimes trauma can lead to dissection. Sometimes even sports activities as well.
Jim wants to know if there were alternatives to this procedure, or is this the one procedure?
This is a procedure.
This is it.
So the first line of therapy is what we call IV thrombolytics. So TPA or TNK, it's a IV clot buster. That is still the first line of therapy. But pretty much as soon as that's given and we see somebody with a large clot like Doug, we come for this aspiration or endovascular thrombectomy procedure.
And then Paul wants to know, what are the risk factors, the most common risk factors for having a stroke?
Yeah, so uncontrolled high blood pressure, high cholesterol, diabetes, and smoking are probably the most common 4 things that we can know and control and treat.
Did you have any of those risk factors?
I was a former smoker in my younger years, and I have been at the pre-diabetic stage before and had to control that via dietary and activity levels.
But it sounds like you had quit. How long had you quit smoking for?
At the time of my heart attack.
At the time of your heart attack. So
Yeah.
that's what kicked you into that.
Yeah.
I'm going to quit.
Yes.
And then the pre-diabetes, is that controlled now?
That's been since then, and it's controlled now. Yes.
Yeah.
Yeah.
So you've got a good team. You've got a good team here
Yeah.
that's helping you. This is so interesting. What is one thing that you wish people knew who don't have medical backgrounds about what to do if they think someone is in medical trouble, having a stroke?
Yeah, so coming back to that acronym, that B FAST.
Yeah.
Balance, eyes, vision, face, arms, speech, and time. If you see somebody with any of those symptoms, just call 911. That would be the best bet you could do.
And is everything back to normal for you as far as speech, vision, no lingering effects of anything?
Yeah, I'm pretty much back to normal.
Do you like talking about this and spreading the word, or does it make you stressed out a little bit thinking about it?
No, I think if it's going to help anyone out there, to know these things, I'm happy to be here and share.
We have a question from Denise. Denise wants to know if you have any big plans that you put off as you were recovering from your heart attack or your stroke.
I don't think so. I just try and be present for the family and do what we can to enjoy our time together.
Those are pretty good plans.
Yep.
You couldn't ask for more. Paul wants to know how much time had passed since Doug's stroke to the actual surgery. So he has a stroke.
Yeah.
From that point, he's on the floor till he sees you in the OR.
Say probably a couple hours or so.
I think it was an hour and a half
Or
to
an
2
hour,
hours.
roughly, yeah.
Yeah.
And how much time, Paul has a follow-up, how much time is allowed before the surgery?
So that's a good question. So we were in a clinical trial years ago called the DAWN study, looking at patients like Doug up to 24 hours. So technically it could be done up to 24 hours as long as the CAT scans, the imaging, are what we call favorable.
Would there be any reason why you would purposely wait that long?
No. But just sometimes with KU being a big catchment area, we get people from Hayes, Kansas, and
Takes a
even
while.
further out. So by the time they get here, it could be 6, 8, 9 hours, even
Right.
longer.
In this case, thank God, it wasn't that.
Yeah.
This was the perfect situation and a horrible combination of events, but your little girl found you and got you to the right guy. This is remarkable, and we love sharing the incredible work of our doctors here at the health system who do all these cool things to save lives. However, we also love showing you what life looks like for them outside the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, Dr. Abraham, we're going behind the mask, and what we love seeing is what gives you joy outside of work when you're not saving lives. Who are these people?
So I have my wife, who's a physician here at KU.
Wait, what does she do?
She's an internal medicine doctor in the executive health clinic. So
you're pretty much a smart family. Did you meet in med school?
No, we met at the end of, I was finishing a fellowship, she was finishing residency up in DC, so.
And then who are the little people?
And then we got
in the family?
Sebastian, the older guy, and Isaiah, the younger guy, 7 and 5.
So all they know is a family of doctors.
I think so, yeah.
Do you have other doctors in your family?
My brother's a physician down in Springfield.
Do your kids like coming to work with you and seeing all your tools? Do they ever get to?
Sometimes I will bring them in for strokes if my wife has something else going on, and they love coming here. So
Can they watch you do procedures from a window?
Yeah, they can sit behind the window and watch. So.
Oh man, that would be so cool.
I think they like it because we also go get chips from the cafeteria afterwards.
Right.
They're big fans of that.
And if they come on Wednesdays, it's Wing Wednesday.
There
so
you
you
go.
can go get wings. You're also Sporting KC fans.
Yes, big Sporting KC fans. So.
And who are you here with?
Again, our boys, and then there's the guy in the middle next to me is Dr. Jackson. He's an ER doc here at KU, and our good friend Connor Sweeney and all our boys. So.
Very sweet. Are you going to catch a KC Current game soon?
We've been, yeah. We're going to be
nice.
going to the next one in June. So yeah.
So cool. Well, thank you so much for being with us today.
Yeah.
Thank you for sharing a little bit about your family. And Doug, thank you for being so open about your journey, and hats off to your little girl.
Thank you.
Because she's the reason why you're here. You're here today with us. Thank you for that. Coming up next week on All Things Heart, this is a milestone few hospitals have reached, and it's having a huge impact for our patients here. We celebrate the technique that eliminates the need for you to go on blood thinners. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update.
So that's when I look over and my pills are there and my hearing aid's gone.
Hearing aids down the hatch, and they didn't come out on their own. I'm Jessica Lovell on the next Morning Medical Update, the mix-up that sent one woman into emergency surgery, where the hearing aids got stuck, and what else she swallowed besides her pills. Friday at 8.